Hi, and welcome to the Ask Dr. Angela podcast with everyone's favorite OBGYN, Dr. Angela Jones. Have you ever been too embarrassed or shy to ask your own doctor about your, girl parts? Well, you've come to the right place to get straight answers. Feel free to ask Dr. Angela anything women's health related. Obstetrics and gynecology? She keeps it real. Pregnancy? She's been there, done that. Menopause? She'll get you through. Young or old, Dr. Angela's got you covered, girl. Now here's Dr. Angela.
What's good, people? This is Dr. Angela, and I would like to officially welcome you to episode 292 of the Ask Dr. Angela podcast. I am so excited for this month. It's March, and I'm going on vacation. March is when my mini has her spring break. They get 2 weeks off for spring break, which is still beyond me. But nevertheless, they get 2 weeks off for spring break, and on one of those weeks, my family takes a trip. Francesca typically determines the destination because this is her spring break, hence her vacation. So she always picks really fun destinations. You know, with her choosing, we've been to Hawaii, we've been to Mexico, we've been to, oh my gosh, where have we been? Cabo San Lucas, which is in Mexico. We've been to Cancun. And I think that the Bahamas were supposed to be on the destination for the spring break, but I think actually that we're either going to just hang out in Miami, or part of that time I'm going to go home and spend with my parents. My parents are in Ohio, and even though that's not like what most would consider an ideal spring break destination, sometimes you just have to go home and recharge, and I am in need of a little recharging. You know, there's nothing like the comforts of home. Home-cooked meals, you get to hang out with your family. For me, it's my siblings, my aunts and uncles. And, it's just really good to be able to let your hair down and just be able to be exactly who you are without any pretenses or, worrying about putting on any airs or people not accepting you for you. So I'm really looking forward to that because I need a little bit of a break. Just dealing with some things in my personal realm that can't be over soon enough, but getting through it and looking forward to being on the other side of it. Anyway, today's podcast, we're going to talk about uterine fibroids. Uterine fibroids, oh my gosh. Every day I'm seeing someone with fibroids. And what I'll tell you about fibroids is that they are a lot more common than not. You can have them and be completely asymptomatic. I guess the reason that this is coming up is I'm not sure if you saw my Instagram. Last week, I posted a picture of a huge uterus that I removed, did a hysterectomy for a woman with uterine fibroids. Her uterus was probably about 20 week size. And in the realm of OBGYN, when I give you week size of a patient's uterus that's not pregnant, we compare uteruses to the size that they would be during the course of a normal pregnancy. So the woman that I was doing this hysterectomy on had huge uterus with huge uterine fibroids, and I ended up doing a hysterectomy because she was symptomatic, i.e., she was having pain, pressure, and more significantly, she was having anemia as a result of really heavy periods that were the result of her uterine fibroids. So you just heard me say that she was symptomatic. The reason that word is important is because women can have uterine fibroids and have no symptoms whatsoever. And the thing to know about fibroids is if they are not causing you symptoms, there's nothing to do. I mean, I've seen women with 20-week size uteruses with fibroids that don't have heavy periods, that don't have pain, and are completely fine. And you know what we did in those women? Absolutely nothing. The only time that surgery really becomes necessary is when things start affecting your quality of life, whether it's because of pain, whether it's because of periods that are so heavy that they are causing you to be anemic, whether that's, as significant as causing you to require blood transfusions, put you on iron, whether you're fatigued because you have low blood counts. All of these things are signs of anemia. What I can tell you about fibroids is that they are typically benign. I'm actually going to quote you 97, 98% of the time, fibroids are benign. And again, most of the time that I diagnose them is just by accident, not unless I have someone that, came in for an annual and I do an exam and on bimanual exam, I feel that their uterus is a little bit enlarged, I might say, I think you might have fibroids. Or if I have a patient that's complaining of heavy periods and I'm looking for an obvious source, and usually when people have really heavy periods, the ultrasound is ordered so that we can look for anything structural, whether it's a fibroid or something like a polyp or even an ovarian cyst. But fibroids can be incidental findings. And if we have a woman that got an ultrasound because we were following up on an ovarian cyst, and she happened to have fibroids, as long as she's not having any symptoms, we don't do anything. We'll just maybe repeat an ultrasound annually just to make sure that it's not growing too fast and that it's stable. There is a rare circumstance where fibroids can be malignant, i.e. cancerous, and those are called leiomyosarcomas, but those are extremely rare. So, Dr. Angela, what do you do for fibroids? Hysterectomy is really a last resort. It depends on really what your symptoms are from the fibroids. If it's bleeding, there are a lot of different things that we can give you to help control bleeding, whether it's something hormonal like a birth control pill, an IUD, perhaps an ablation, uterine ablation, or, maybe it's something a little more aggressive but not so invasive like a uterine artery embolization. A lot of women that don't want to lose their uterus for whatever reason might opt for uterine artery embolization, and that helps to, cut off the blood supply to the fibroids, most of the time causing them to shrink and necrose and, hence significantly decreasing a woman's bleeding. Myomectomies can be performed for fibroids, but unless there is some reason that we need to preserve your uterus, i.e. you're interested in childbearing, you haven't had kids yet, or if you're trying to get pregnant and the fibroid is interfering with the endometrium or the lining of the uterus, those are circumstances where you might consider having a myomectomy or having the fibroid removed, because certainly what we do know is that fibroids, if they interfere with the lining of the uterus, they can increase your risk of miscarriage, decrease successful implantation of the fertilized egg. If you do happen to get pregnant with fibroids, it's something that we do serial ultrasounds on to keep an eye on, because they certainly can continue to grow. And depending on where they're positioned, sometimes they can interfere with baby's growth or even baby's positioning in the uterus. But a lot of women, as long as the fibroids don't interfere with the lining of the uterus or the endometrium, go on to have full-term pregnancies without any complications. I happen to be one of those women that had a lot of fibroids in my uterus. I didn't have any of them removed because they didn't interfere with the lining of my uterus, and I had a full-term healthy pregnancy. But anyway, fibroids can cause a lot of bleeding. And, the one thing about fibroids that I don't like is that they can certainly distort the pelvic anatomy. This hysterectomy that I did not so long ago, it was a really difficult case. The uterus was big, it was bulky, but luckily it was successful and we were able to complete it without consequence. The patient subsequently did really, really well and will lead a much happier life afterwards. I mean, there's nothing like not having to buy tons of tampons and pads. I mean, sometimes people that have such heavy periods, you'd be surprised at how much money they spend on a monthly basis on these things. So uterine fibroids, how do fibroids form? Your uterus is basically made of smooth muscle. And what happens with fibroids is that the cells of the uterus become what we call hyperplastic, which means that they proliferate, they grow in bundles. And I've seen fibroids be anywhere from the size of a pea to the size of baseball to the size of a cantaloupe. My partner and I once removed a uterus that was about 25 weeks gestation. It was huge. We got that uterus out and it literally looks like a watermelon. It was basically about the size of a watermelon. So they can get to be really, really, really big. And again, most of the time, fibroids are benign. So with regards to treating fibroids, it really comes down to treating the symptoms. If you do decide to leave your uterus in situ or in place and treat just some of the symptoms that are associated with fibroids, whether that's heavy periods, etc., just keep in mind that things like ablations, birth control pills, Mirenas, they don't affect the fibroids because fibroids are hormonally responsive. So as long as you have ovaries that are working, your fibroids will continue to grow. Thank you so much for tuning in to this episode of the Ask Dr. Angela podcast. As is the usual, it's always a pleasure. If you happen to have a topic or questions that you would like addressed in the podcast, you know where to reach me. www.askdrangela.com. That's AskDrangela.com. You have access to all of my social media outlets. That's Instagram, Twitter, Facebook. You can direct message me. You can email me. I will eventually get to your query. I'm so excited about my book that's coming out April 9th. Please, please, please keep your eyes and ears peeled for that. Also on the website, you can access my YouTube channel. I'm doing a lot more in-depth addressing of topics. I'm doing more in-depth addressing of actually fibroids, ovarian cysts, and endometriosis this month. So every week there'll be a different topic that's more than a minute. I'm listening to you all. You guys are like, please expound, elaborate. So I heard you and I'm doing it. So please make sure that you check out my YouTube channel for a more in-depth detail on some of the topics that I'm covering. So until next time, look better, feel better, be better. Cannot wait to reconnect on episode 293 of the Ask Dr. Angela podcast.
Thank you for listening to the Ask Dr. Angela podcast. For more information on women's health and the show notes for this episode, please visit Dr. Angela at www.askdrangela.com. While you're there, don't forget to leave your own message for Dr. Angela. See you soon! All of the information provided and discussed in this podcast is for educational and informational purposes only and should not take the place of consulting a physician. This podcast is not intended to diagnose, treat, or cure any disease or illness and does not and should not replace treatment from a medical professional.